New coronavirus infections and hospitalizations are falling in the United States. Health officials cite a variety of reasons. But as the holiday season approaches, there are also concerns about the pandemic and the nation's economic health. Friday's jobs report showed fewer Americans are getting back to work than expected. In addition, supply chain issues are being felt in stores across the country. CBS News senior correspondent Mark Strassmann has more.
Woke people.
Hey, can you watch your language?
No.
There are around kids.
More than a moment short of a disorder. COVID America has functioning anxiety. Day after day, living with this lingering virus.
We will not comply. We will not comply.
Upset, uncertain, on edge. Frustrated other people who ironically feel the same way won't come to their senses.
We want to end this pandemic. We are all exhausted by it.
Including most vaccinated Americans. Our new CBS poll found 56% of them said they were at risk because of the unvaccinated. The virus, with no end in sight, has killed more than 700,000 Americans. There is some hope, cases now declining in 32 states.
1, 2, 3.
And Pfizer's hoping its vaccine for kids ages 5 to 11 gets emergency approval by the end of the month. Not a moment too soon, as the Delta variant remains pitiless. Our relationship status with America's economy also complicated. Cash-happy consumers want to spend, but too often the message in stores, we're out of that. Empty grocery shelves in North Carolina, food shortages for schools, and yet off the coast of Southern California, 500,000 shipping containers wait for unloading. Even good news seems to come with a catch. Take America's new jobless rate, less than 5%. Fewer than 200,000 new jobs were created last month, a major disappointment. Even with millions of openings, employers can't find good help these days, or any help. Millions of jobless people now stay home. Why risk working and catching COVID, especially for mediocre money?
What do we want? What do we want it? No!
At Buffalo's Mercy Hospital, this strike has drifted into its second week. Hundreds of healthcare workers demanding more staffing and better pay. They're stressed and they've had it. Sound familiar? More pandemic stress is on its way for private employers. OSHA is still working on issuing emergency guidance for mandatory vaccinations and testing for any company that has at least 100 employees. At least 24 states have promised to fight it. Lana?
Mark, thank you. Joining me now is CBS News reporter Alex Tin. He covers all things pandemic related for us. Hey there, Alex. I want to start with the Pfizer vaccine for children ages 5 to 11. We're now just potentially weeks away from an FDA decision on that pediatric shot. And a new CBS News poll shows a significant divide, though, when it comes to vaccinating children. Among vaccinated parents, 61% said that they would vaccinate their children, but an equal percentage of unvaccinated parents say that they will not. How does all that factor into achieving herd immunity?
Well, thanks. That's a great question. You know, we have learned over the past few months, even before the Delta variant, that children had been as much, if not more likely to catch and transmit COVID-19 compared to adults, right? That is a significant shift that happened earlier this year in our understanding of the virus, even before the highly contagious Delta variant. So obviously, we know now that children play a significant role in potentially ending this pandemic. We also know that in some situations, children are in a unique situation to transmit and spread COVID-19. Schools are the perfect example of that. It doesn't matter if, 80 to 90% of their community appears to be, fully vaccinated around them. If you have an outbreak in that school and almost all of the children there are too young to be vaccinated yet, that's not going to stop an outbreak at that school. Layered mitigation strategies, masking, ventilation, social distancing, obviously can mitigate that outbreak, but vaccination alone cannot, right? In addition to all of that understanding that we know now about the risk that children potentially could pose towards not only spreading and catching COVID-19, we also know that federal health officials have recently expressed worry that the recent downtick that we've seen in cases might be plateauing in some communities. Part of that is the lack of vaccination among many adults who are currently eligible to be vaccinated. Part of it we also know is potentially the waning immunity that's coming from people who had natural immunity to COVID-19, and that's, waning. And part of that we know, too, is potentially these children in these communities that make up significant portions of the community can catch COVID-19 and spread it and just can't be vaccinated yet.
Well, Alex, I want to ask you more about those numbers going down, because hospitalizations and new infections are in fact declining after a summer surge that was fueled by the Delta variant. For some people who maybe are vaccine hesitant, they see these numbers going down and it tells them that they don't need to necessarily overcome their vaccine hesitancy. Tell us more about why these numbers are going down. What would be the public health response to people who are thinking that? And are officials expecting that these numbers will continue to decline in the future?
Sure. Well, there's a couple interesting threads there. Let's separate those apart, right? We know on the one hand, there is a significant body of research and evidence now that shows that people who aren't vaccinated, even if they manage to survive their first infection of COVID-19, do see a significant reduction in their risk of potentially catching COVID-19 and spreading COVID-19 in the future if they get vaccinated. So there is clearly a benefit for most people, even if they manage to survive their first COVID-19 infection, to get vaccinated. We also know that there's some growing evidence that's being studied now about the potential for COVID-19 vaccination to resolve symptoms, especially long COVID symptoms in some people who survived their COVID-19 infection. So as at a personal individual level, there's a clear benefit to getting fully vaccinated against COVID-19, even if you've been previously infected and managed to survive the virus. But separate from that, from a public health standpoint, we know that the decline in cases, which has been seen abroad and elsewhere, highly vaccinated countries, has happened, in multiple places at multiple times as this Delta variant surge has subsided. But we also know that there is a major risk that many health experts are concerned about, and that we've seen happen already in some countries abroad, where that, drop in cases is followed by smaller surges in cases in different communities around those countries and different communities around our country, especially in places that have lower vaccination rates. Without getting too far into the weeds on the science on why that is, we know that part of that is because natural immunity isn't the same for every person, right? If two people get, sick with COVID-19 and survive it, the immunity that they bring from that is not the same and doesn't necessarily apply to every other variant. And we also know there are unique risk factors as we go into these colder months of the year when people spend more time indoors. And we know that respiratory viruses like COVID-19 spread very easily in those settings.
So, Alex, a very important point that you raised about immunity, that even if somebody has gone through COVID and survived COVID, that there still are health benefits both to the individual and to society if that person still gets vaccinated. But as you're starting to talk about the winter months, tell us more about how this winter might compare to last year.
There are reasons for optimism that we've heard from federal health officials, and obviously a lot of reason for concern. The reason for optimism is simple, right? We know more people are vaccinated against COVID-19. We know more people have survived COVID-19. And we now know a lot more about how we can mitigate the spread of the virus. But at the same time, there's a couple reasons for concern. The first is obviously the potential need for booster shots to reduce infections of the virus among some people whose immunity might be waning against COVID-19. In addition to the potential need for booster shots, we know that there's a significant concern for example, flu outbreaks, which we know had been so low last year because of all these COVID-19 mitigation strategies like masking and social distancing that just aren't being implemented with the same rigor in most communities around the country. Mix that in with the fact that, we know, again, without getting too far into the science of it, that the natural immunity from previous flu infections is probably very low right now because people weren't, infected with the flu virus last year. There is a real concern that we could see a significant surge in flu hospitalizations. You combine that with small localized surges of COVID-19 hospitalizations, and we could be right back where we started, which is overwhelmed ICUs, hospitals, and other healthcare providers facing a huge surge of both flu and COVID-19 patients as we go into these winter months. And obviously, to be clear, that's a good reason why you should get vaccinated against the flu.
Vaccinated against the flu and vaccinated against COVID-19 is the advice from health authorities. You mentioned booster shots. Tell us about the latest guidance on boosters for the 3 different vaccines being used in the U.S., Pfizer, Moderna, and Johnson & Johnson.
Sure. Well, just to recap, as we know, Pfizer currently is the only authorized booster shot in the United States. That's only for people who were initially fully vaccinated with Pfizer shots and only applies to some subsections of people in that group 6 months after they first finished their primary series. The jury is still out for Moderna and Johnson & Johnson recipients, but federal health officials have said that after a meeting of the FDA's vaccine advisors this week, the VRBPAC as they're called, they expect to find what they call a, quote, harmonized approach for all of the vaccines. That could potentially mean that, a Moderna recipient would get a 3rd dose of Moderna, or a Johnson & Johnson recipient would get a 2nd dose of Johnson & Johnson. But we're also expecting data this week to be presented to the FDA's vaccine advisors about potentially mixing and matching shots. For example, if you're a recipient of Johnson & Johnson's vaccine, could you get safe and potentially better immunity from a 2nd dose of Moderna's vaccine instead of a 2nd dose of Johnson & Johnson's vaccine? Those are questions that we're probably going to hear ironed out before the FDA's advisors this week. After that meeting, the FDA will probably come up with some formal authorization for how that will work out. We're expecting a CDC meeting by the end of this month that will sort out those recommendations, which could mean that booster shots for all Americans, not just Pfizer recipients, could be recommended probably by the beginning of next month.
Very interesting. Again, that group, though, the subsection that you were mentioning, older adults, people who are immunocompromised or have other underlying health conditions, and anybody whose workplace might potentially make them more at risk. Alex Tin, thank you so much.
Thank you.